Hi Pete, why can't you use Clopidogrel with Omeprazole?
Why are you moving like that? Right, I don't think...
Thank you so much for asking me that, Kyle. You might have also noticed this interaction popping up on your clinical system, so let's look into it. Clopidogrel works by making the platelets less sticky, and because clots in fast-flowing vessels like arteries are platelet-rich, this helps to prevent events like strokes and heart attacks. The Clopidogrel we give to patients is referred to as a prodrug. This means it has to be activated before it will affect the platelets. This activation is triggered by an enzyme in the liver that snips a bit off the Clopidogrel molecule. This enzyme is part of the cytochrome P450 or CYP isoenzyme family. There's loads of these enzymes and they play a role in the metabolism of most drugs, and some drugs can affect the activity of CYP enzymes themselves, in turn having an effect on other drugs in the body. The CYP enzyme that activates Clopidogrel is called the CYP2C19 isoenzyme. Lab studies raise concerns about Omeprazole because it reduces CYP2C19 activity, and they thought this would reduce the activation of Clopidogrel, which would also reduce the antiplatelet effects. And they felt all this could ultimately increase the risk of strokes. There's been a selection of good studies investigating this effect in practice, and there's some debate still about whether this interaction does indeed significantly increase the risk of stroke. But when other proton pump inhibitors like lansoprazole have minimal CYP2C19 activity, most clinicians agree that Clopidogrel and Omeprazole just shouldn't be used together. If you're interested in learning more, I've included a link to a really good paper which explores this in more detail. If you're not interested, I won't be offended. All you need to remember is, if you're wanting to prescribe stomach protection for a patient on Clopidogrel, your first line option should be lansoprazole 15 to 30 milligrams once a day. See you next time.